how important is preconception care for men?
Oh, it's essential. It just doesn't happen or happen enough. You look, we're having these conversations with our female partner, our female clients, and the one side of the relationship, it feels like. And they're always asking, okay, how can I be proactive? What can I start to do now? When do I start to be engaged in these things? Before we're ready to start trying. I don't hear that on the male side of things. And, if it takes two to tango, which it does, preconception care to me is not just a one-sided thing. We're talking about preconception. It takes two to conceive. We need both of you to be proactive in that process. And the more we can do before we're ready, before we want to conceive, the easier that process is going to be for ourselves. My feeling is like the conversations that I hope couples are having in a relationship before they get engaged, once they get engaged, they're planning their wedding. My hope is to start to see preconception care get intertwined with those conversations.
Right.
Just like we're having, what's your dreams in life? And, you're getting to know someone in a relationship, wanting to know if this is the person you want to spend your life. And, I'm hoping they're even asking the question, do you want to have children? And I know that question isn't always asked, by the way. And they find out later that,
right.
No, I don't want to have kids. Well, I want to have 5 kids. How are we going to figure this out? We're already married, right?
Right.
So I want to me, that's preconception care. Well, let's have these real conversations, these hopefully not so difficult conversations beforehand. Do you want to have children? How many do you want to have? Okay, well, what are we going to start to do now to be prepared for when we want to? And my hope is if it doesn't happen, if those conversations don't start to happen as they're planning their wedding, that when they get back from their honeymoon, or maybe it needs to happen before in some instances because of what happens on the honeymoon. And so many people, we got pregnant on our honeymoon, is that they're starting to have those conversations around that time frame saying, okay, well, let's enjoy life together. We want to have kids in 2 or 3 years. What are we going to start to do now to prepare our bodies for that? Right. And I'm not suggesting we all need 3 years of preconception care, although preconception care for me is not a, finite moment. It's a process, but, let's start to be conscious about this and let's start to take ownership for our health and our bodies. So that way, when we want to conceive, we're better able and hopefully faster able to do that.